Hello and welcome. Today's video is about a condition called Beauty Parlour Stroke Syndrome, otherwise BPSS. Usually, going to a hairdresser is a relaxing and pampering experience, but it could turn out to be a serious health threat, known as Beauty Parlour Stroke Syndrome or BPSS. This is also called hairdresser-related ischemic cerebrovascular event or HICE. I have experienced some neck pain and was not comfortable during my visit to the salon because we have to keep our head extended on the basin for hair wash. Some of you have experienced something like that. So as you all know, a stroke is a brain attack caused by a sudden reduction in blood flow to the brain. It's usually caused by a blockage from a blood clot or rupture of major blood vessel in the brain, leading to a reduction of oxygen, glucose and nutrients that damages and kills brain cells. So this particular type of stroke, that is the Beauty Parlour Stroke Syndrome, was first identified in 1993 by an American neurologist. So this doctor noticed severe stroke-related symptoms in his patients after having their hair washed during a visit to a hairdresser. So what could be the reason? So during hair wash, we sit in an awkward angle, placing our head on the edge of hairdressing wash basins. And usually it is a hard surface we are placing our head. Tilting the head into the salon sink reduces blood flow to the brain. This could cause neck pain, headache, dizziness, vertigo, and sometimes on rare occasions ischemic stroke. And this occurs due to the compression of vertebral artery in the atlanto-occipital region during rotation or hyperextension of the neck over the sink basin. Research suggests that overextending the head and neck over the rigid rim of the sink is the primary cause of Beauty Parlour Stroke Syndrome. The unusual neck position, neck rotation or sudden jerking movements during vigorous shampooing can cause the backbones of the higher spinal column around the neck area to push against one of the major blood vessels that supply blood to the brain. This leads to artery dissection or vertebral artery compression. So, what are the signs and symptoms? Let us get into more details. So, you can experience sometimes headache, lightheadedness, dizziness, vertigo, blurred vision, nausea, vomiting, pain in the neck, loss of balance, and in serious or extreme conditions, sometimes weakness of limbs, speech difficulties, and paralysis on one side of the body. Some patients also report a near loss of consciousness. So studies suggest that the symptoms may be delayed, making it difficult for doctors to diagnose BPSS rather than a conventional stroke. So the tricky part is sometimes it occurs immediately after the hair wash, but sometimes it could be delayed for few days or weeks after visiting salon. So it could happen to anyone. However, research suggests that some people are at risk. So now we will look at what are the risk factors. Women over 50 and previous history of narrowing or thinning of blood vessels and arthritis of the spinal column in the neck, they are at a particular risk. And the duration of the extended position, the longer duration is higher the risk. And some of the health problems. People with some health problems also are at high risk. That includes chronic smokers, people with uncontrolled diabetes, hypertension, etc. How common it is? You may argue that it is not common. You have not seen anyone getting this type of stroke, or you have not experienced any of these symptoms. But the reality is, this is reported in various medical literature and many cases reported around the world, from India, from US, UK, European countries and other Asian countries. So it's not very common, but it do occur Coming to the prevention aspect. So what precautions we can take to avoid this beauty parlor stroke syndrome? First of all, we have to be aware that this can occur, and if you are at a risk or you have any risk factors, you have to be extra careful. Ensure that your neck is placed in a comfortable position while your hair is being washed. Your neck should not be bent backward for more than 15 to 20 degrees and not more than 10 minutes in the hyperextended position. So the duration matters. And there are ergonomic designs and functional equipments for hair wash available which doesn't require hyperextension. But I agree that many beauty parlors doesn't have these equipments. And if you are worried about BPSS and if you are at high risk, or if you experience pain and discomfort when using a backwash sink, you can ask for a forward hair wash. You don't have to lean backward over the sink. You can lean forward over the sink for hair wash rather than extending your head backwards. And if this is not possible, you can ask for neck support, and also wash basin and chair could be adjusted according to your height, etc. And a simple device called shampoo funnel for washing hair in an upright position that could be used for high risk people. And the speed at which hair is washed matters, and any force or jerking movement of the head and neck, that all contribute to the risk factors. It is not only just hair wash, the head massage and also certain procedures in a hyperextended in this particular position, all that can contribute to this particular stroke. And sometimes the vigorous movement used by the hairdressers for head massage or hair wash, that should be taken into consideration. You can request for a gentle wash. So any jerky or sudden movement or sudden rotation, all these factors can contribute to this beauty parlor stroke syndrome. I would like to conclude this video by saying that getting a hair wash or hair shampoo or head massage in a hair salon is an enjoyable experience, but we need to keep in mind about this health condition and then take necessary precautions. Thanks for listening to this video. Please share to your friends and also to your hairdresser and your beauty parlor staff. So thank you once again. Please like, share and subscribe. Goodbye.